A lot of people are worried about going to the hospital, mistakes, infections we keep hearing about, and we wondered about outpatient care. When should you choose outpatient care? What kinds of surgeries, and how do you make that decision? Joining us this morning is Dr. Lisa Thornton with some answers.
Sure. Well, if you're somebody with very complex medical conditions, you don't want to be in a surgical center because you are more likely to have complications.
Complex meaning what?
Well, if you have major heart disease, if you have several kinds of problems like hypertension, heart disease, diabetes all together, if you're elderly, if you're over 65, sometimes that can be a reason not to go. And also, very obese patients sometimes aren't right for surgical centers. So all of those things make you at higher risk for problems after surgery in recovery, and that may need an admission to the hospital. So you want to already be in a hospital just in case.
Parents should take note. Federal health officials are issuing a new warning that cough and cold medicines should not be given to children under 2 without a doctor's okay.
These are not harmless medications, and they really do need to be dosed very appropriately and, as I said, minimally for very young children.
New York City.
On this morning's Health Watch, a new fad, smoking Smarties. After decades of warnings about the dangers of smoking, there's concern this new fad could encourage kids to start lighting up.
Well, according to the videos, they take the Smarties,
Which we all remember from our childhood, little Smarties candies.
and they crush them in the packet.
Okay.
They crush them up, and then they open one end, and they partially open the other end, and then they hold it like this.
Like a cigarette.
Like a cigarette, or like this, and they puff the sugar into their mouth and then let it come out, and it looks like they're smoking. I knew right away she was onto something.
Yeah?
Because one thing we know as pediatricians is that music and movement really helps children learn. If you think about yourself, one of the first songs any of us learned was the ABC song. And we all remember it. Music helps things get in and stay in. And when children are having fun, they learn better. So I knew that what Candy was doing wasn't just for her son who has a disability, but for all children typically developing or with disabilities.
It's time now for GMA Medical Mondays. Most of us think of summertime as a season of fun and relaxation, but summer is also known as trauma season, a stretch when the number of accidental injuries and deaths spike.
It is, and I've seen terrible tragedies in this regard. I had an 8-year-old child who was swimming in their backyard pool. The dad was very close by washing the windows. His back was turned. He realized it was very silent, turned around. His daughter was at the bottom of the pool.
That's what's frightening, is that it can be
terrible.
silent.
It is almost always silent. It's not like in the movies where people splash around and yell help. So you want to always keep your eyes on your children when they're in the water. That's the #1 safety tip. Organ and tissue donation is so important, but sometimes so misunderstood. Every day in this country, people die waiting for organs. The bottom line is, you could save a life and give new hope to so many thousands of people with chronic diseases by being an organ donor. So today, we're talking to Jack Lynch. He's the Director of Community Affairs for the Gift of Hope Organ and Tissue Donor Network.